Hello, this is Aaron Shoemaker, and I'm here with Dr. Joel Carey, who is a sports medicine physician, and he's going to talk to us today about St. Vincent sports performance in the new St. Vincent Center.
Absolutely. We recently opened the St. Vincent Center downtown here in Indianapolis as a combined effort with the Indiana Pacers. So it's actually in the Indiana Pacers training facility, which is a unique situation. Not many NBA teams have that arrangement, but we have all of our services on the 5th floor of the St. Vincent Center, which includes physician services, digital x-ray, our use of ultrasound, and we have performance training services, rehab, a weight room, sports psychology, sports nutrition, all of the services that we normally provide at our sports performance locations.
Great. So now we're downtown and working with the Pacers. In addition to that, we have our sites in Fishers and Carmel.
Correct.
And what should we be thinking as primary care doctors to use your services more, or when, and what's the right utilization?
Sure. I think the way that we can be most helpful to our primary care providers is, one, is providing that walk-in clinic from 8 to 10 every morning, Monday through Friday, at all of our locations. So that if you have a patient who calls in and says, I just sprained my ankle last night, I've got an event scheduled this weekend, what do I do? Well, you can always have them come in from 8 to 10 in our walk-in clinics. And like I said, we have x-ray capability, we have boots, casting, bracing, whatever they might need to help with that initial evaluation and management of that injury. But beyond that, we see, of course, athletes of all ages and activity levels, whether they like to just run fun runs on the weekends or whether they're really competitive. We see all ranges.
That's great. So all ages, really. And what about some of our general orthopedic issues that may be a little more chronic in nature rather than acute?
Absolutely. I think that's where we can help guide those conditions that don't need surgery, but perhaps might benefit from rehab, and they just need an initial evaluation, kind of a plan put together. So even if it is somebody who's in their 50s or 60s and has knee pain that bothers them on a daily basis and keeps them from being active, we can certainly help them with that condition so they can be active. And, from a primary care standpoint, make them healthier, reduce the risk of diabetes, lower their cholesterol, all those things to keep them exercising and active. And in addition to that, when we do see other athletes, we see them for more than just musculoskeletal conditions. We see sports concussions, athletes who have difficulty with breathing while running. We do blood work. On the 4th floor of the St. Vincent Center, we have a primary care office that has a lab, so we can do blood work there. So I think the beauty of the St. Vincent Center downtown is that it's pretty comprehensive as far as what we can provide for our patients.
That's great. Thanks, Dr. Carey, for sharing that with us. I know I use sports performance for my acute sports injuries with my family, with my patients, also with some of my non-operative adult patients who I think could benefit from help to get back to exercise, things like that. So I really appreciate the service. I'd love to see us optimize and utilize the service as much as possible and keep that work in the family and help our patients as much as we can. Lastly, I would mention the St. Vincent Center is both primary care and sports performance. So all your friends and family who are downtown, start utilizing our service. Thank you.